I was sitting there talking with a girl. She was probably about 22 or 23 inside the Wood Group. It's a respite residential center is what it is. And she had been coming off drugs. And we were just sitting out there talking outside. And I didn't even realize what I was doing. And when I got up, after we quit talking, when I got up, she gave me the biggest bear hug. I mean, you talk about, I mean, it surprised me so much, and my heart just felt like it just went all the way up in my neck. I mean, it was just like it jumped out, and I knew what I wanted to do for the rest of my life. A certified peer specialist means that you meet somebody at their own, at where they're at. You're there to help them find housing, help them find employment, help them recover, help them know how to manage their illness, help them learn about their illness, and set goals, you know. But when I facilitate groups and I have my own office and they think that I'm Spindletop and I'm some kind of clinician, they won't talk to me. And so that's the first thing I do is I tell them, you know, I'm a client also right here at Spindletop. And I was in maybe not the same position as you, but I was down and out myself, and you can get better. And we do make good role models, because sometimes you feel like you're just helpless and hopeless and you can't pull out of that. But it's a good support system, it really is. They're like my therapy, you know, because I empathize with them. I've been there, I've done that, and I understand sometimes the reason people do these things. And don't understand everything, of course, but you should see them when we get ready to have group and I tell them that I'm a client. They're like, really, you know, and you work here? I said, yeah, and you could do the same thing, you know. Everything's a possibility, you know. You got to have that little spark, you know, to kind of, well, what are you interested in? What do you want to do, you know? What did you used to enjoy? Because you lose all that a lot of times when you do drugs or you just have mental health breakdowns or whatever, you know. So, you know, they have to have some kind of hope. And I think that's what we bring to the table for them.